I mean, I have to say it's really confusing, even for somebody who's following the news closely and watching what's been happening. In New Jersey here yesterday, they lifted the stay-at-home order, but people had already been going out and kind of moving about much more freely before that happened. They now say you can have gatherings of up to 100 people, but you should try to socially distance and wear masks whenever possible. It's just really confusing. It was confusing enough before, but getting these kinds of mixed signals still makes you wonder what's okay and what's not. I mean, I guess we're all kind of testing this out together, but how would you advise people to be listening to something like that? You get invited to, let's say, a bridal shower. Do you go?
I think I would listen to local advice. I think part of what's confusing is there is a patchwork of approaches across the nation. Some states that have a lot more spread are opening up a lot more. Some states that have been much more aggressive, have much less spread, are being much more prudent. The tri-state area is actually in the best shape nationally in terms of the reproduction rate right now. You know, I would still try to limit social activity. I would still wear masks. I think we're going to have universal masking for a while now, or at least try to impose that. And I would still try to limit my, trips out of the house, group shopping trips, limit social activities, particularly in congregate settings and indoor settings where spread is, it's more conducive to spread. Certainly in the tri-state area, we are in better shape than other parts of the country. But when you look at hotspot regions like Arizona and Texas, they have to be concerned, particularly areas around Houston right now. They can lose control of this very quickly. I think that the seasonal effect that we talked about, there's probably an upper limit to that, and we might have already reached the benefits of that seasonal effect. We might not get much more effect as we get into July and August. So this might be it, and we might be stuck with this level of spread, and we're going to have to figure out how to keep that from going higher.
Doctor, just to follow up on that final question, when you think about what's taking place in Texas, and you said we won't go back, what should we think, though, is acceptable? Meaning, you're going to see, as you said we had 2,000 hospitalizations in the state of Texas right now. I hate to say this, but it appears, just based on the statistics, that you would think that 2,000 hospitalizations could result in somewhere between 100 and 200 deaths, based on the way these statistics seem to go. The question is, if that number gets to 5,000 or to 10,000 in terms of hospitalizations, obviously, therefore, the risk of death becomes higher. How do you think that, I know you're saying that states are going to continue just to stay open, but politically and within the healthcare community, at what point do you think that there becomes a real fight over this?
Look, I think that they're going to base it on hospital utilization and resources available to take care of people who are sick. But this is a very hard needle to thread. The idea that we can manage through a certain level of disease and kind of keep it there, this is a very contagious disease. And we're not going to be able to fine-tune this and find just the right level of disease that we can tolerate and not have to take those tough mitigation steps, but not get above those levels. And so this is a very precarious situation that we're entering into right now, where we seem to be willing to tolerate a level of disease and think that we can control it and keep it at that level. We're going to be looking at hospital resource utilizations and when the hospitals get pressed. I think you're going to start seeing pushback from providers heading into the late summer and the fall if we continue to see this level of spread. Providers aren't going to want to practice medicine in a COVID-only system because policymakers don't have the fortitude to take decisions to try to, reduce the spread and take some tough mitigation steps, especially at a local level. Now, what we really need are states that have good contact tracing in place and good testing in place. And this is why we talked about the importance of contact tracing. It isn't just to try to keep the numbers down, but it's to try to fine-tune those mitigation steps and know where the spread is occurring. If Texas finds out that the spread is happening in bars and they've reopened bars to 50 or 75%, they can bring them back down or shut them back down and just have a surgical intervention. They need to figure that out. The contact tracing is going to tell them that.